Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates.
Let's look at what is known as a penetration trauma. Penetrating trauma. So this penetrating trauma is the most common injured organ. It involves the liver, the stomach and the small intestine. So most common injured organ will be the liver, followed by the stomach, and then we have the small intestine. So the most common injured organ in case of the GSW, it is going to be the small intestine. So this is going to be the small intestine. Next is, what is the exploration laparotomy is mandatory. So GSW, what we meant is the gunshot wound. So what is most commonly involved? It will be the exploration laparotomy. It becomes mandatory, and the most common organ involved will be the small intestine, as we discussed earlier. So you must have an exploration laparotomy. So what are the complications of this exploration laparotomy? So complications, it involves, there is presence of the wound dehiscence. So wound dehiscence, there is also presence of the pneumonia, and there is a cardiac complications. Next, there can be a prolonged paralytic ileus, there can be a enterocutaneous fistula, as well as systemic sepsis. Now, looking at the penetrating trauma. So, in case of penetrating trauma, there can be two types. That is, there can be a gunshot injuries as well as an anterior stab wound. So, gunshot injuries is where you have a exploration, you do exploration laparotomy. You do exploration laparotomy. And next is in case of an anterior stab wound. So in case of anterior stab wound, you look for the peritonitis. So in case of peritonitis, then there can be shock and the evisceration. So in such cases, we again go for the exploration laparotomy. Then another pathway will be by looking for the local wound exploration. So local wound exploration, and then you go for the peritoneal breach, and after that, in case it is positive for the CECT, so positive for the CECT, then you move on for the observation. Then there can be a serial examination. Also, the hemoglobin every 8 hourly. Then we move on to the hemodynamic instability. Then you go for a significant decrease in the hemoglobin, and also the leukocytosis is also seen. Next, the other pathway is they can also be, you go for the wound closure as well as the discharge.
To learn and grow daily like this, please do subscribe.